Okay, so imagine this. You're feeling totally awful, cough, fever, you can barely breathe, and you finally drag yourself to the doctor. And they mention pneumonia. Pretty scary, right?
It can be.
And to figure out exactly what's going on, they'll probably order a bunch of lab tests.
Yeah, they will.
And today we're going deep on those tests specifically for you guys because we got a ton of requests from you wanting to better understand how pneumonia is diagnosed and managed.
Right, and those tests are really like pieces of a puzzle,
Oh, I like that.
helping doctors get a clearer picture of what's happening in your lungs.
Okay, so let's start putting those pieces together then.
Sounds good.
First up, and this is often the very first test they'll run, is the complete blood count, the infamous CBC.
Yes, the CBC.
Now, I know some of you might be thinking, wait, I've had a CBC before. What's the big deal? But here's where it gets interesting for pneumonia.
Yeah, CBC, for a suspected pneumonia case, it's less about the overall number of white blood cells and more about the specific types.
Okay.
It's like looking at the troops your immune system is sending out to battle.
Ooh, I like that analogy.
Yeah.
So who are these different troops?
Well, you've got your neutrophils, which are like the frontline soldiers. They rush in to combat bacterial invaders.
Okay.
So if your neutrophil count is high, that's a pretty strong clue that you could be dealing with bacterial pneumonia.
So if I see neutrophils elevated on my results, I could actually ask my doctor, hey, does this mean it's likely bacterial?
Yeah.
That's useful.
Exactly. Now, on the other hand, if your lymphocyte count is up, that might suggest a viral infection is causing the pneumonia. Lymphocytes are more like the intelligence officers of your immune system, crucial for fighting off viruses.
Wow. I never knew there were so many specialized cells in our immune system.
Oh, there are.
So based on this first test, the CBC doctors can start to get a sense of whether they're dealing with bacterial or viral pneumonia.
Exactly. But to really nail down the culprit, they need to go a step further.
Okay.
That's where blood cultures come in.
Okay, blood cultures, we're getting serious now. Break it down for me. What exactly are they looking for in the blood?
They're trying to catch the bacteria red-handed, so to speak.
Okay.
A blood sample is taken and then carefully grown in a lab to see if any bacteria multiply. And if they do, it allows the doctors to pinpoint the exact species causing the pneumonia.
But hold on, wouldn't antibiotics already be in the system by the time someone gets to the hospital? Would that mess up the blood culture?
That's a great question, and it highlights why timing is so crucial with this test. Ideally, blood cultures should be taken before any antibiotics are started.
Makes sense.
It's like trying to collect evidence at a crime scene. The sooner the better.
I like that. Okay, so we've looked at the blood, but what about getting information directly from the lungs? Isn't that where the pneumonia action is happening?
Absolutely, and that's where sputum analysis comes in.
Okay.
Sputum is that lovely mucus you cough up from your lungs. Not the most glamorous substance I know,
I can imagine.
but it can hold valuable clues.
Okay, I'm no ears. Tell me what those clues might reveal.
Well, one of the quickest and most useful tests is the Gram stain, which was actually discovered by accident back in the 1880s.
Wait, really?
Yeah, by a Danish bacteriologist. Believe it or not, he was trying to make bacteria more visible under a microscope and stumbled upon the staining technique that differentiates bacteria based on their cell wall structure. You got gram-positive bacteria, which stain purple, and gram-negative, which stain pink.
So it's like a quick fingerprint analysis to see what kind of bacteria we might be dealing with.
Exactly. This helps guide initial antibiotic choices while waiting for the full sputum culture results, which can take a few days.
Makes sense. So the gram stain gives us a preliminary ID, and the full culture confirms the specific bacteria. This is fascinating stuff. So far, we've got the CBC blood cultures and now sputum analysis. Are there any other lab tests commonly used in the pneumonia puzzle?
Definitely. There are also tests that can measure the level of inflammation in the body. Two important ones are C-reactive protein, CRP, and procalcitonin.
Okay, I've definitely heard of CRP before, but procalcitonin is a new one for me. What can these tests tell us?
Both CRP and procalcitonin, they rise when there's inflammation in the body, which is a natural response to infection. But here's the key difference. CRP is a general marker, while procalcitonin is much more specific to bacterial infections.
Okay, so procalcitonin is like that super sleuth that can really narrow down the suspects.
Exactly.
I'm starting to see how these tests work together to give doctors a more complete picture.
Exactly. And speaking of a complete picture, we can't forget about how the pneumonia is actually affecting breathing. Right. That's where the arterial blood gas test, or ABG, comes in.
ABG, I've heard that one thrown around, but I'll admit it sounds kind of intimidating. What exactly are they measuring with this test?
It's actually less scary than it sounds. They take a small blood sample from an artery, usually in the wrist, and measure the levels of oxygen and carbon dioxide in the blood.
So it's directly checking how well those lungs are doing their job of gas exchange, getting oxygen in and carbon dioxide out. That's crucial.
Absolutely. The ADG results can help doctors decide if someone needs supplemental oxygen or even more intensive support like mechanical ventilation.
Wow, this test can really be life-saving in serious cases.
It can be.
It's like checking the engine of a car to make sure it's getting enough air. Okay, we've covered a lot of ground already. CBC blood cultures, sputum analysis, CRP procalcitonin, and now ABG. Are there any other lab tests in the pneumonia arsenal?
There are a few more specialized tests that might be used.
Okay.
For example, if doctors suspect a specific type of bacteria, like Streptococcus pneumonia, they might order a urinary antigen test.
Wait, you can detect pneumonia bacteria in urine. That's surprising.
It is. These tests are super helpful when it's hard to get a good sputum sample or when a very rapid diagnosis is needed.
Got it. Another tool in the toolbox. Are there any other high-tech tests we should know about?
Well, there's PCR, which you might remember hearing about during the COVID-19 pandemic.
Ah, yes, PCR. The test that seemed to be everywhere.
How is it used for pneumonia?
PCR is incredibly sensitive and specific. It can detect the tiniest amounts of genetic material from viruses or bacteria. It's like having a superpower that can spot microscopic clues. Okay, so if those initial tests aren't giving a clear answer, PCR can help identify those tricky pathogens that might be hiding.
Exactly. It can even pinpoint those rare atypical bacteria that are hard to catch with traditional methods.
This is all really fascinating, but I have to be honest, it's a lot to keep track of. It seems like there are so many lab tests involved in diagnosing pneumonia.
You're right, there are. And that's why it's so important to remember that no single test tells the whole story. It's the combination of results, along with the patient's symptoms and imaging like a chest x-ray, that creates a full picture.
Okay, so it's really all about putting the pieces together like a puzzle. Right.
Exactly.
Yeah.
And speaking of puzzles, I think it would be helpful to walk through a hypothetical scenario
Sure
to
thing.
see how these tests might be interpreted in a real case.
I like it.
Let's say someone comes in with those classic pneumonia symptoms: cough, fever, shortness of breath, chest pain. The doctor orders that battery of tests we've been discussing. What if their CBC shows a high white blood cell count with a lot of neutrophils? What does that suggest?
Well, from what we've learned, that points towards a bacterial infection, right? Those neutrophils are the first responders rushing in to fight those bacterial invaders.
You got it. Now let's say their blood culture comes back positive for Streptococcus pneumonia.
Okay, so now we have a specific suspect. Case closed.
Not so fast. Remember those inflammation markers we talked about?
Right.
What if this person also has elevated CRP and procalcitonin levels? What does that tell you?
Well, those markers confirm there's inflammation happening. And since procalcitonin is more specific to bacterial infections, it supports the idea that Streptococcus pneumonia is the culprit.
Exactly. And to complete the picture, imagine their ABG shows slightly low oxygen levels, indicating their breathing is being affected by the pneumonia.
Oh.
So in this scenario, we have several pieces of evidence pointing towards bacterial pneumonia caused by Streptococcus pneumonia: the high neutrophil count, the positive blood culture, the elevated inflammatory markers, and the ABG showing some difficulty breathing.
Okay, that makes sense. It's like the pieces of a puzzle falling into place. Of course, this is a simplified example, but it really helps to see how these different tests work together.
It does, and it highlights how crucial lab tests are in guiding diagnosis and treatment decisions for pneumonia.
This has been incredibly insightful. I feel like I'm starting to speak the language of lab tests, at least when it comes to pneumonia.
That's the goal. The more you understand about these tests, the more empowered you are to understand what's happening in your own body.
Absolutely. So for our listeners who might be feeling a bit overwhelmed by all this information, can we quickly recap the key takeaways so far?
Of course, we've covered a lot of ground, but the main point is this: lab tests are essential for diagnosing and managing pneumonia. And remember, it's not just about one magic test. It's about putting together the clues from various tests, along with clinical signs and imaging, to get the full picture.
So the next time you or someone you know has to deal with pneumonia, and you see those lab reports, don't be intimidated. You'll have a better idea of what those numbers and terms really mean.
Exactly. Knowledge is power, especially when it comes to your health. And remember, we've only just scratched the surface of this fascinating field. There's always more to learn, and we encourage you to keep exploring. Now, before we move on to our next segment, I want to highlight something we often overlook: when talking about lab tests.
And that is the emotional side of things,
Yeah,
the stress of it all. I
absolutely.
mean, let's be real. Waiting for results, especially when you're feeling sick, could be super stressful.
It really can. That anticipation, the fear of the unknown, it can really weigh on people. And sometimes, even when the results are normal, there can be that lingering worry, like, what if they missed something?
Oh, totally.
Yeah.
It's like even good news can't fully erase that initial anxiety.
Yeah.
Yeah, so what advice do you have for our listeners who might be struggling with this emotional side of it all?
Well, first and foremost, don't bottle it up. It's okay to feel nervous or scared.
Yeah.
Those are totally natural human responses.
Yeah.
Talking to your doctor about those feelings can be really helpful. They can often provide reassurance or address any specific concerns that you have.
Right. They're not just there for the physical stuff. They're there to support you emotionally, too.
Exactly. And don't forget about your support network outside the doctor's office, too.
Yeah.
Lean on trusted friends and family, or consider talking to a therapist if those feelings are becoming overwhelming.
Uh-huh.
Taking care of your mental and emotional well-being is just as important as the physical stuff.
Absolutely. Well said. And, speaking of the journey, I think it's worth pointing out that lab tests aren't just for diagnosis.
Right.
They're also used to track how well treatment is working.
Right, absolutely. Once treatment for pneumonia has started, especially antibiotics, doctors often repeat certain tests to see if things are moving in the right direction. It's like checking the map to make sure you're on the right track.
Okay, so they might recheck the CBC, for example, to see if those white blood cells are decreasing.
Exactly. That would suggest that the infection is being controlled. They might also repeat those inflammation markers, CRP and procalcitonin, to see if those levels are dropping.
Right. So it's like those tests become benchmarks to monitor progress. And if those markers aren't improving as expected, wouldn't that be a red flag?
It could be. It might signal that the initial diagnosis was off, or that the chosen antibiotic isn't the best fit for that particular bacteria.
Okay.
And in those cases, the doctors would need to adjust the treatment plan.
So those follow-up tests can be really crucial for fine-tuning the treatment and making sure it's actually working.
Absolutely. They provide valuable insights throughout the entire course of the illness, not just at the beginning.
Yeah, it's all about that feedback, Luke, isn't it?
It is.
Getting those data points to make sure everything's heading in the right direction.
Yeah.
I'm really starting to appreciate just how much goes on behind the scenes in this world of lab testing.
It's a complex field, but once you understand the basics, it becomes a lot less intimidating.
For sure. And speaking of knowledge being power,
Mm.
I think there's a really important point here for our listeners, advocating for yourself and being an active participant in your healthcare.
Oh, absolutely.
Knowing about these lab tests gives you the tools to ask informed questions and have more productive conversations with your doctor.
Couldn't agree more. It's not just about passively receiving information. It's about actively understanding what's going on and being a partner in your own care.
So instead of feeling overwhelmed by those lab reports, you can actually use them as a starting point to learn more.
Right?
And ask your doctor, okay, what does this mean for me?
Exactly. You can ask them to explain the results, why they chose certain tests, how those results are influencing their treatment decisions. It's all about open communication.
Yeah, it's empowering.
Yeah.
You're not just a patient following orders, you're part of the decision-making process.
Exactly. And knowledge is key to being an effective advocate for your own health.
Absolutely.
Yeah.
This is all so valuable. I think our listeners are really going to come away from this deep dive feeling more confident and informed about pneumonia lab tests.
I hope so. It's a topic that can seem daunting at first, but when you break it down, it's actually quite logical.
Absolutely. And that's what we're all about here on the deep dive, right?
Exactly.
Taking complex topics and making them accessible and interesting for everyone.
Absolutely. Now, before we move on, I think it's worth emphasizing that lab results are always looked at in the context of the individual patient.
So you mean what's normal can vary from person to person?
Absolutely. Age, underlying health conditions, even the medications you're taking, those can all affect your lab values.
So it's not just about seeing a number and comparing it to some generic chart.
No.
It's about understanding what that number means for you in your unique situation.
Exactly. That's why having those open conversations with your doctor is so important. They can help you make sense of those results and explain how they fit into your overall health picture.
That's great advice. And speaking of the bigger picture, I think we should also remind our listeners that prevention is always the best medicine.
Oh, absolutely. There are simple, everyday things you can do to reduce your risk of developing pneumonia in the first place.
Like good old-fashioned hand washing. I know it sounds basic, but it's incredibly effective at preventing the spread of germs.
It really is. And covering your coughs and sneezes, staying up to date on your vaccinations, especially for the flu and pneumococcal disease, those are all key preventative measures.
Such important reminders.
Yeah.
Okay, we've talked about different types of pneumonia lab tests, how to interpret them, their role in tracking treatment progress, the importance of patient advocacy, and even some prevention strategies. Wow, we've covered a lot of ground.
We have, and I hope our listeners feel better equipped to navigate this complex world and have those crucial conversations with their healthcare providers.
I'm sure they do. Now, before we wrap up with our final thoughts, there's one more thing I wanted to touch on that I think will be particularly fascinating for our listeners, and that is the future of pneumonia diagnosis and treatment.
Whew.
We've talked about all these tests, but technology is changing so rapidly. What's on the horizon? What should our listeners be keeping an eye on?
Oh, that's a fantastic question, and one I get really excited about.
Hmm.
We've already seen incredible advancements like rapid molecular tests that can identify the exact pathogen causing pneumonia in a matter of minutes, not days.
Yeah. Wow, that's a game changer.
It is.
I remember waiting days for culture results,
Right.
and it was nerve-wracking. Anything else that's really changing the game?
Absolutely. We now have portable devices that allow for point-of-care testing.
Okay.
This means tests that used to only be done in a lab can now be done right in the doctor's office or even at the bedside.
Wow.
This is especially valuable in critical care settings where every minute counts.
So faster diagnosis, faster treatment.
Yeah.
That's incredible. What about the role of artificial intelligence?
Yes.
I hear so much about AI in healthcare these days. How's it impacting pneumonia care?
AI is becoming a really powerful tool, for sure.
Yeah.
Researchers are developing algorithms that can analyze chest x-rays and CT scans to detect pneumonia even in its early stages, sometimes before it's even visible to the human eye.
That's amazing.
It is.
So it's like having an extra set of eyes, and incredibly intelligent ones at that. What else can AI do in this field?
AI can also help predict which patients are at highest risk of developing complications from pneumonia. This allows doctors to intervene earlier and potentially prevent those complications from happening.
Wow, this is also fascinating. It sounds like the future of pneumonia care is going to be incredibly high-tech and personalized.
It really is. And I think it's important for our listeners to stay informed about these advancements.
Yes.
They have the potential to completely revolutionize how we approach pneumonia diagnosis and treatment.
It's definitely inspiring to think about all the possibilities. While we've been focused on the current landscape of lab tests in this deep dive, it's clear that technology is going to play a major role in shaping the future of pneumonia care. So as we wrap up this episode, what final thoughts do you have for our listeners? What's the one thing you'd like them to remember as they continue on their journey of learning and taking charge of their health?
I think the most important message is this: never underestimate the power of knowledge.
Couldn't agree more. Understanding the tests, understanding your own body, that's where empowerment starts.
Exactly. Don't be afraid to ask questions. Do your own research and be an active participant in your healthcare. You are your own best advocate.
Well said. And while we've covered a lot of scientific ground today, I think it's also important to remember the human side of things.
I'm so glad you brought that up. It's easy to get caught up in the technical details, but behind every lab result, every diagnosis, every treatment plan, there's a person.
A person with their own story, their own fears and hopes. We can never forget that human element.
Absolutely. And sometimes the most powerful medicine we can offer is simply listening with compassion and understanding.
Beautifully said. So to our listeners out there, remember, you are not alone. There are incredible healthcare professionals, researchers, and fellow patients who are dedicated to improving pneumonia care and supporting you on your journey.
And never underestimate the power of your own voice. Speak up, ask questions, and be an active participant in your own health.
That's a perfect note to end on. Thank you so much for this incredible deep dive.
It's been my pleasure. It's always a joy to explore these topics with you and our amazing listeners.
And to everyone listening out there, thanks for joining us on this journey. Until next time, stay curious, stay informed, and stay well.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.